Before you put your shoes on today, I want you to do something that takes less than 30 seconds. Take a good look at your feet. Not because you're checking for dry skin, not because you're looking for a blister, but because your feet may be revealing a health problem that has been developing silently for years without causing any obvious symptoms. Most people believe diabetes announces itself with constant thirst, frequent trips to the bathroom, or unusually high blood sugar readings. While those are certainly common signs, the truth is far more surprising. In many people, the earliest clues appear much farther away from the heart, the pancreas, or the brain. They begin at the very bottom of the body, your feet. I'm Dr. James Carter, and today I'm going to show you several warning signs that your feet may be trying to communicate long before a serious diagnosis is ever made. These changes don't automatically mean you have diabetes. Many other medical conditions can produce similar symptoms. But when several of these signs appear together, they deserve attention instead of being dismissed as just getting older. Here's why. Your feet depend on thousands of tiny blood vessels and delicate nerves that work around the clock. Because these structures are so small, they're often among the first parts of the body affected when blood sugar remains elevated for months or even years. Long before someone develops severe complications, these microscopic blood vessels may already be under stress. The nerves may begin sending unusual signals. Skin may heal more slowly. Temperature changes may become noticeable. Small differences that seem harmless can sometimes reflect much bigger changes happening inside the body. That's why doctors don't simply look at laboratory numbers. We also pay attention to what the body is trying to tell us. And your feet can tell an incredible story. Over the next few minutes, I'll walk you through some important warning signs that many people overlook every single day. Some of them are subtle, others are surprisingly easy to check at home. More importantly, understanding these signs may encourage you to have an important conversation with your healthcare provider before more serious complications develop. As we go through today's video, don't focus on finding one isolated symptom. Instead, pay attention to patterns. One sign alone may not mean very much. Several changes appearing together paint a very different picture, and the first warning sign we're about to discuss is one that many vascular specialists take extremely seriously because it can reflect much more than what's happening inside your feet. Let's begin. The first thing I want you to notice isn't your skin. It isn't your toenails. It's your circulation. Healthy feet require a constant supply of oxygen-rich blood. Every step you take depends on arteries delivering nutrients to muscles, skin, and nerves. When circulation becomes compromised, your feet are often the first place where subtle problems begin to appear. Imagine a neighborhood where every house depends on one main road for deliveries. If traffic becomes slower every month, the homes farthest away receive supplies last. That's very similar to what can happen inside the body. Your feet sit at the end of an incredibly long transportation system. When blood flow decreases, they notice first. Some people begin experiencing feet that always feel unusually cold, even when everyone else in the room feels comfortable. Others notice that one foot consistently feels different from the other. Another common clue appears while walking. Perhaps you enjoy taking a daily walk around your neighborhood. Everything feels fine during the first several minutes, but then your calf starts aching. You slow down, rest for a moment, and the discomfort disappears. Once you begin walking again, the pain gradually returns. Many people assume they're simply out of shape. Sometimes that's true. But recurring discomfort during activity that improves with rest can also be a sign that the muscles aren't receiving enough oxygen-rich blood while they're working. This deserves medical evaluation because reduced circulation doesn't only affect the feet. The same risk factors that narrow arteries in the legs can also affect blood vessels supplying the heart and brain. That doesn't mean every sore calf predicts a heart attack, far from it. But it does remind us that the vascular system functions as one connected network. Here's a simple observation you can try at home. Sit comfortably in a well-lit room and compare both feet side by side. Do they look similar in color? Does one appear noticeably paler? Does one consistently feel colder? Are there changes that you've never really paid attention to before? These observations are not diagnostic tests, but they can help you recognize patterns worth discussing with your healthcare provider. Another change many people overlook involves temperature. If one foot repeatedly feels much warmer than the other, especially in the same area day after day, It may indicate localized inflammation or tissue stress. In individuals living with diabetes, healthcare professionals sometimes monitor temperature differences because persistent changes may appear before more obvious skin problems develop. Your body often whispers before it shouts. The challenge is learning how to recognize those whispers. But circulation is only one piece of the puzzle. Even when blood flow appears normal, another silent process may already be changing the way your feet move, support your weight, and respond to everyday pressure. And that's exactly what we'll explore next. Circulation isn't the only system affected when blood sugar remains elevated over time. Your nerves and muscles can also begin changing in ways that are surprisingly easy to miss. In fact, many people don't notice these changes because they happen so gradually that the body simply adapts. Let's start with the way your toes look. Have you ever looked down and noticed that one or more of your toes seem to curl downward instead of lying flat? Maybe you've developed a callus beneath the ball of your foot that keeps coming back no matter how often you remove it. Many people assume it's simply a normal part of aging. Sometimes it is, but sometimes those changes tell a different story. The small muscles inside your feet work continuously to keep your toes balanced while you stand, walk, and climb stairs. These muscles rely on healthy nerves to receive constant instructions from the brain. When those nerves begin functioning less efficiently, the muscles may weaken. Gradually, the tendons pull with uneven force, changing the position of the toes. Instead of resting naturally, the toes may begin curling into what's commonly called a hammer toe or claw toe. At first, this may seem like nothing more than a cosmetic issue. The real concern is what happens underneath. As the shape of the foot changes, body weight is no longer distributed evenly. Certain areas begin absorbing much more pressure than they were designed to handle. That's when thick calluses often appear. Think of a callus as your body's protective cushion. It develops because the skin is trying to defend itself against repeated pressure and friction. Removing the callus may improve appearance temporarily, but it doesn't solve the reason the callus formed in the first place. It's similar to repainting a ceiling without repairing the leaking roof above it. The visible problem returns because the underlying issue remains. This becomes especially important for people living with diabetes because repeated pressure combined with reduced sensation may increase the risk of skin breakdown over time. Speaking of sensation, let's talk about something that many people don't realize is changing until it's already progressed significantly. Imagine walking barefoot across your living room. Can you feel the cool hardwood floor? Can you tell the difference between carpet and tile without looking? Can you feel a small pebble beneath your foot? Our nervous system performs these tasks automatically every second of every day. Healthy nerves constantly send thousands of tiny messages to the brain, allowing us to adjust our balance without thinking about it. But when peripheral nerves become damaged, those messages become weaker or delayed. Some people describe the sensation as walking on thick socks even when they're barefoot. Others say it feels as though they're stepping on soft foam or cotton. One of my patients, a retired teacher named Michael Anderson, described it perfectly. He said, "It feels like my feet are still asleep after waking up every morning." He wasn't experiencing pain. He was experiencing reduced awareness. Ironically, losing pain can actually become dangerous. Pain exists for a reason. It warns us when something is wrong. Without that warning system, a small cut, blister, or burn may go unnoticed until it becomes much more serious. Here's a simple awareness exercise you can try. The next time you're sitting comfortably, close your eyes and gently touch different parts of each foot with your fingertips. Notice whether both feet feel the same. Can you clearly identify where you're being touched? Do both sides respond equally? This isn't a medical test and shouldn't replace professional evaluation. But becoming familiar with what's normal for your own body can help you recognize changes earlier. Because the sooner you recognize a change, the sooner you can discuss it with your healthcare provider. But nerve function isn't the only thing that quietly changes. Sometimes your skin, your hair, and even your toenails begin telling the same story long before you realize what's happening beneath the surface. Let's take a closer look. Most people think healthy circulation is only important for the heart. In reality, every layer of your skin depends on a constant supply of oxygen and nutrients. Even your toenails rely on tiny blood vessels that most people never think about. That's why subtle changes in appearance can sometimes reflect changes occurring much deeper inside the body. Let's begin with something surprisingly common: hair loss. Not the hair on your head, the tiny hairs growing on your toes and lower legs. Take a moment to look closely. If those hairs have gradually become thinner or disappeared over time, it's worth paying attention. Hair follicles are incredibly active structures. They require a steady supply of nutrients delivered through very small blood vessels. When circulation becomes less efficient, the body naturally prioritizes organs that are essential for survival. Hair growth often becomes a lower priority. That doesn't mean missing hair automatically indicates diabetes. Many factors, including aging, genetics, and certain medications, can influence hair growth. However, when reduced hair growth appears alongside other changes we've discussed, it becomes another piece of a much larger puzzle. Now let's move to your toenails. Healthy toenails usually grow steadily, remain relatively smooth, and maintain a fairly consistent color. But over time, some people notice that their nails become unusually thick, yellow, brittle, or difficult to trim. The first assumption is often a fungal infection. And yes, fungal infections are extremely common. But here's something many people don't realize. Poor circulation and elevated blood sugar can create an environment where fungal organisms are much more likely to thrive. In other words, the infection may not always be the beginning of the story. Sometimes it's the result of changes that have already been taking place beneath the surface. I remember speaking with a patient named Margaret Wilson. For nearly 3 years, she tried every over-the-counter antifungal product she could find. Nothing seemed to work for very long. Eventually, further medical evaluation revealed that the bigger issue wasn't simply the nail itself. Her circulation had gradually declined, reducing the ability of healthy tissue to repair and defend itself. Once the underlying medical problems were properly addressed, caring for the nails became much more effective. Your skin can also provide valuable clues. Perhaps you've noticed that your feet seem unusually dry, regardless of how much moisturizer you apply. Maybe small cracks keep returning around the heels, or tiny injuries seem to take longer than expected to heal. These changes may occur because the skin depends on healthy nerves and blood vessels to maintain moisture, repair itself, and protect against everyday wear and tear. When those systems become less efficient, even simple skincare products may not completely solve the problem. Again, none of these changes should be viewed in isolation. One thick toenail doesn't diagnose diabetes. One cracked heel doesn't confirm nerve damage. Medicine rarely works that way. Instead, healthcare professionals look for patterns, combinations, and progression over time. And the next warning sign we'll discuss is one that many people describe as the most uncomfortable of all. It often begins after the lights go out, when the house becomes quiet and you're finally trying to fall asleep. We've talked about circulation. We've talked about muscles. We've talked about changes in the skin and toenails. Now let's discuss the symptom that often brings people into the doctor's office because it's nearly impossible to ignore. It usually doesn't begin during the day. It begins after the lights go out. You're finally lying in bed after a long day. The room is quiet. You pull the blanket over your legs, close your eyes, and within minutes, something feels wrong. Your feet begin to burn, not because they're warm, not because you've been walking all day. It's a strange sensation that's difficult to describe unless you've experienced it yourself. Some people say it feels like they're standing on hot pavement. Others describe tiny electric shocks shooting through their toes. Some feel constant tingling, while others notice sharp stabbing sensations that seem to come and go without warning. The frustrating part is that nothing appears wrong from the outside. Your feet may look completely normal, yet the discomfort can be intense enough to interrupt sleep night after night. Why does this happen? Healthy nerves communicate using tiny electrical signals. When those nerves become irritated or damaged, the messages traveling to the brain become distorted. Instead of accurately reporting temperature or touch, the nerves may begin sending pain signals even when nothing harmful is happening. Think of it like a home security alarm that's become overly sensitive. Instead of sounding only during an emergency, it starts going off every time the wind blows. The problem isn't outside the house. The problem is inside the alarm system. Our nervous system can behave in a very similar way. One of my patients, Daniel Foster, came to see me after nearly a year of interrupted sleep. He told me, "Every evening it feels like my feet are on fire. I end up sticking them out from under the blanket just to get comfortable." He assumed poor circulation was the only explanation. But after a thorough evaluation, we discovered something more complex. Several factors were affecting his nerve health at the same time. His blood sugar had remained elevated longer than he realized. He had also developed a vitamin B12 deficiency, which can occur in some people taking certain medications for type 2 diabetes, including metformin. It's important to understand that not everyone who takes metformin develops a vitamin B12 deficiency. However, because the possibility exists, many healthcare professionals recommend monitoring B12 levels in people who use the medication over long periods, especially if symptoms of neuropathy begin to appear. Vitamin B12 plays an important role in maintaining the protective covering around nerves. Without enough of it, nerves may not function as efficiently as they should. Another nutrient that deserves attention is vitamin B1, also known as thiamine. Thiamine helps nerve cells produce the energy they need to function normally. People who consume excessive amounts of alcohol over many years, or who have certain nutritional deficiencies, may become low in this vitamin as well. Again, this doesn't mean everyone with burning feet has a vitamin deficiency, nor does it mean every vitamin supplement will solve the problem. That's why proper medical evaluation is so important. Burning feet can have many different causes, including diabetes, vitamin deficiencies, thyroid disorders, kidney disease, medication side effects, and several neurological conditions. The goal isn't to guess. The goal is to identify the real cause. Because once you understand what's creating the symptoms, you and your healthcare provider can develop the most appropriate treatment plan. The good news is that your body often provides warning signs long before serious complications develop. Recognizing those warnings early gives you something incredibly valuable: time. And that's exactly what we're going to talk about next. By now, you may have recognized one or two of the changes we've discussed today, or perhaps you haven't noticed any of them at all. Either way, there's one important message I hope you take away from this video. Medicine is rarely about a single symptom. It's about patterns. One cracked heel may simply be dry skin. One thick toenail may be caused by a fungal infection. Cold feet may simply reflect the temperature in the room. Individually, these findings often have completely harmless explanations. But when several of these changes begin appearing together, and especially when they're accompanied by elevated blood sugar, numbness, burning sensations, slow wound healing, or a family history of diabetes, they deserve a closer look. Think of your body as a sophisticated communication system. Long before major organs begin failing, the body often sends small messages. A little less sensation, a little slower healing, a little more tingling, a little less circulation. None of those whispers should create panic. But they also shouldn't be ignored. One of the biggest misconceptions I hear is, if I don't have pain, everything must be fine. Unfortunately, that's not always true. Some of the most significant complications associated with diabetes develop gradually and quietly. People often feel perfectly well while changes are occurring beneath the surface. That's one reason routine medical care is so important. If you're concerned about your blood sugar, or you've noticed several of the warning signs we've discussed today, talk with your healthcare provider about appropriate testing. Depending on your personal medical history, your clinician may recommend tests such as fasting blood glucose, an HbA1c test, or in some cases an oral glucose tolerance test. These aren't just numbers on a laboratory report. They're tools that help build a clearer picture of what's happening inside your body. The encouraging news is that many of the factors influencing nerve and blood vessel health can be improved. Maintaining healthy blood sugar levels, choosing balanced meals, staying physically active, managing blood pressure, getting enough sleep, avoiding tobacco, taking medications exactly as prescribed, and following up regularly with your healthcare team. None of these changes happen overnight, but they don't have to. Small decisions repeated consistently often produce meaningful improvements over time. Remember, the purpose of today's video isn't to diagnose disease. It's to help you become more aware of the signals your body may already be sending. Because awareness is often the first step toward prevention. And in our final section, I want to share why those first small steps matter so much and why, regardless of your age, there is still an opportunity to protect your health moving forward. If you've stayed with me until this point, I hope you'll remember one thing above everything else. Your feet are not trying to scare you. They're trying to communicate with you. Our bodies rarely change overnight. In most cases, they spend months or even years sending small signals before a major health problem develops. A little numbness, a little dryness, a little tingling, a wound that heals more slowly than it used to, changes that are easy to ignore because they don't seem urgent. But those small changes deserve your attention, not because they guarantee something is wrong, but because they offer an opportunity to act while you still have time. That's one of the greatest advantages of preventive medicine. The goal isn't to wait until symptoms become severe. The goal is to recognize early patterns, investigate them appropriately, and make changes before permanent damage occurs. I've spent many years caring for patients with cardiovascular disease, and I've noticed something remarkable. The people who achieve the best long-term outcomes aren't necessarily the ones with perfect genetics. They're the people who respond when their bodies begin whispering, instead of waiting until those whispers become emergencies. If today's video encouraged you to look at your feet a little differently, don't stop there. Schedule the appointment you've been postponing. Ask questions. Review your blood sugar if you haven't checked it recently. Take your medications exactly as prescribed. If your healthcare provider recommends lifestyle changes, remember that meaningful progress doesn't require perfection. Small improvements practiced consistently can make an enormous difference over time. A healthier breakfast, a daily walk around the neighborhood, choosing water a little more often than sugary drinks, getting enough sleep, taking care of your feet every day instead of only when they start hurting. These habits may seem ordinary, but over months and years they help protect the blood vessels and nerves that quietly support every step you take. And here's something equally important. Don't keep this information to yourself. Think about someone you love. Perhaps it's your spouse, your brother, your sister, a parent, a longtime friend, or someone who has been living with diabetes for years and assumes numbness or burning feet are simply part of getting older. Sharing reliable health information can sometimes encourage a conversation that changes a life. You never know who might decide to schedule a medical appointment because of something they learned today. Before we finish, I'd like you to do one simple thing. Take another look at your feet tonight. Not with fear, not expecting to diagnose yourself, just with curiosity. Become familiar with what's normal for your body, because the better you know your own health, the easier it becomes to recognize meaningful changes if they ever appear. Remember, awareness is not anxiety. Awareness is preparation, and preparation gives you choices. If you found today's discussion helpful, I'd appreciate it if you subscribed to the channel and shared this video with someone who might benefit from it. My goal is to make complex medical topics easier to understand so that more people can take an active role in protecting their health. Now, there's one important topic we haven't covered yet. Many people assume that protecting nerve health is only about controlling blood sugar. While healthy glucose management is incredibly important, it's only one piece of the picture. Certain nutrients also play essential roles in supporting normal nerve function, and many people have questions about whether they're getting enough of them, especially individuals living with diabetes or prediabetes. In my next video, we'll take a closer look at the science behind vitamin B12, vitamin B1, alpha-lipoic acid, and several other nutrients that have been studied for their role in nerve health. We'll also discuss who may benefit from testing for nutrient deficiencies and why supplements should always be chosen carefully with guidance from a healthcare professional. If that sounds helpful, click on the video appearing on your screen now. I'm Dr. James Carter. Thank you for spending this time with me. Take care of yourself, stay curious about your health, and I'll see you in the next video.